Hi everyone, welcome to researchmd.com. Today we're going to address another statistical term, and it's all about odds ratio. We're going to teach you everything about odds ratio, what you need to know. Okay, so what is odds ratio? If you look at the definition, it's a measure of association for a case control study. Okay, it quantifies the relationship between an exposure and a disease in a case control study. I want to underline the case control study. Okay, if you're asking a question in the examination, they can put like several studies, and they're going to say like, how is the odds ratio related to which study? Always pick the case control study. What is the formula to calculate it? First thing you have to do is you created this 2x2 table and you label them, right? Disease outcome at the top, and positive or negative, and exposure or intervention on the left side is a positive or negative, and then you label them A, B, C, D, okay? So what is our formula to take a look at it? The formula is odds of exposure in those with disease divided by odds of exposure in those without disease, okay? Remember that. So if you do that, it's actually A divided by C divided by B divided by D. To convert that, you're going to say A into D divided by B into C. Always remember that. The formula is odds of exposure in those with the disease divided by odds of exposure in those without the disease, okay? Now, anytime you have an odds ratio, it's associated with the confidence interval. So like, let's say 95% of the confidence interval. You're saying, I'm saying that 95% of the time, the mean or odds ratio lies in between those ranges. And it should not include 1 because it's a ratio. 1 divided by 1 is not significant, right? So either in the confidence interval, if it include 1, there is no relationship at all. If it is greater than 1, there's a positive relationship, okay? If it is less than 1, it's an inverse relationship or negative relationship, okay? Always remember that. So let's do some of the example. So I'm going to say another example at this point. In a case control study, 40 out of 60 females, age group 18 to 35, and 10 out of 50 males of same age group report love at first sight, and we're going to calculate the odds ratio for love at first sight. I don't think anybody else did it. So you created the 2x2 table, and you create females and males on the top. On the left side, love at first sight, yes or no. And then you calculate our odds ratio, which is AD divided by BC, and then we got odds ratio of 8, okay? So love at first sight, females are 8, odds ratio is 8 to see the relationship between the love at first sight between male and female. Again, calculate the odds ratio, it is 8, okay? Now, interpretation, we already talked about the 1. If it is greater than 1, positive correlation. If it is less than 1, negative correlation. Let's do some practice questions now. Number 1. In a case control study involving 110 participants, 50 people tested positive for COVID-19 and 20 people were tested negative for COVID-19, did not use the face mask to protect themselves. Calculate the odds ratio. I'm going to stop the screen just for a second. I'm going to give you time. Create your 2x2 table. Okay. Now let's look at the answer. We created this 2x2 table, COVID positive or COVID negative. On the left side, face mask, no or yes. And then use our formula AD divided by BC. Our odds ratio is 17.5. Okay. Now, the next question. A group of patients with asthma is matched to a group of healthy individuals. Their smoking habits over the course of their lives are compared to this an example of what study? Longitudinal study, cohort study, randomized control study, case control study, or cross-sectional study. So what kind of study is it? I'm going to pause for a second. You read the question and answer it, okay? So this is what? A case control study. Looking back, retrospective, okay? Now, number 2, on the basis of this information, researchers compute the odds of smoking among patients with asthma compared to the odds of smoking among healthy individuals. Calculate the odds ratio. You get 500 patients, 150 out of 250 patients with asthma, and 50 out of 250 healthy individuals reported of smoking habits during their life. So I'm going to stop it for a while, and then You do the calculation and then let's see the answer. Now we're going to create the 2 by 2 table first. Asthma or yes or no. Okay, on the left side, smoking, on the left side, smoking, yes or no. Odds ratio AD divided by BC, you get odds ratio of 6. Okay. Now, the next is a lengthy question. This is actually a study I published a few years back. In one of our study conducted to examine the prevalence of risk factors of heart failure in the U.S., we investigated the association between various risk factors for heart failure. So we have coronary artery disease with odds ratio 8.87, hypertension 3.38, diabetes 2.06, age 65 or older, high cholesterol, and you got abnormal alcohol consumption. And we gave you the odds ratio in the middle, and on the right you had the confidence interval. So from the table above, what's the correct interpretation of the high cholesterol value of high cholesterol value, which is 1.42, right? Now let's look at our option. High cholesterol individual odds of having heart failure are 42% lower than the odds of having heart failure of the normal individuals. Number 2 choice, high cholesterol individuals also having heart failure at 42% higher than the odds of having heart failure for normal individuals. Number 3, there's no statistical significance between high cholesterol level and heart failure. Number 4, overall risk of heart failure is 1.42 times higher in patients with high cholesterol level compared to normal individuals. So I'm going to stop. Please read the question and answer. Let's move on. The answer is there is no relationship. If you look at our our odds ratio is 1.42. Our confidence interval from 0.98 to 2.02. It involved 1, my friends, so there is no relationship. Okay, remember that. So that's my presentation. Remember, odds ratio is for case control, looking at the the exposure and the disease, and also always look at the confidence interval. And the point is, if you remember, like if it include 1, is not significant. If it is greater than 1, positive relation, less than 1, negative relationship. And always remember, it's in case control study. Thank you very much for joining us. Bye.